I have been observing all the Thursday meetings, but today I think most of the times we have been discussing about the hardcore psychiatry topics like bipolar, speech or dementia, like their substance. Today is one of the very interesting and most tempting topic. I think today it will be houseful. Probably we cannot accommodate all the participants also. Such is the response I am getting from some of my colleagues here and there. And so Ahalya is one of the best speakers for that. I know her since she was my batchmate in Emans in 80s. And also she is very good in this marital therapy and family therapy. She has done a lot of work. Anyway, Dr. Vipul is going to introduce Dr. Ahalya Raguram. Later, I think I'll just take 2-3 minutes just to introduce the topic to all of you. So over to Dr. Vipul Singh, our good friend from Kanpur. He is associate professor. Over to Dr. Vipul ji.
Thank you, sir. Can I have the slide? To start with, I would like to thank the Odisha branch of IPS for giving me opportunity to chair a session of a legend of clinical psychology in our country. Dr. Ma'am is a former professor and head of Department of Clinical Psychology in NIMHANS. She has a clinical and teaching research interest reflects a long-standing and abiding interest in family and couple therapy. Her focus has been on intervention modules which are congruent with the cultural beliefs and expectations of the families in our country. Her research work has explored the role of burden, attitudes, quality of life, marital adjustment in the family context. She was an expert member of the advisory committee of Indira Gandhi National Open University for curriculum development of a course in family counseling, probably the first started by the university. She was a visiting professor at the University of Washington, Seattle. The Indian Association of Clinical Psychologists, as I told you, she's a legend in clinical psychology in the country. Has honored her as one of the 50 eminent clinical psychologists who have contributed to the advancement of profession in our country. She has more than 30 research publications in peer-reviewed journals. She is also co-editor of 2 books entitled Ethical Issues in Counseling and Psychotherapy Practice and Changing Marital and Family System, Challenges to Conventional Models of Mental. Madam, welcome. And Reddy sir, you will give a short comment before you can start with your talk.
Thank you, Dr. Vipul. I think today, Dr. Ahalya, what I probably expect that she's going to speak more about our topic is mainly the healing ruptured relationships. What I understand from this is probably she's going to speak more about the extramarital relationships or the infidelity or adultery, whatever you speak. Probably she's going to focus, and probably she's also going to speak other relationships like father-son and friend-to-friend. These are some of the ruptured relationships she's going to focus. But to my knowledge, I think she's going to mostly speak on extramarital relations. So let me say a few points on this because this is going to be very interesting. The extramarital relationships are there since human existence. And also since the mankind has started. When the marriage has started, extramarital relations also have started simultaneously. And it doesn't mean that once somebody has got some extramarital relationship or adultery or infidelity, it doesn't mean that that is the end of love between the two partners. Still, happy marriages also continue in spite of the extramarital relation. Doesn't mean that at the end of the marriage, marital relationship. And in many surveys, it has found that previously people were thinking in the past, men were supposed to have more extramarital relationships. But in the recent studies, they have found that women are no less than men. Of course, the percentage is slightly higher in men. In about 41% of the marital couple, when have admitted to have some relationship sometime or other in their life. That is the percentage. Maybe this is a Western study, but of course, India also it is slowly catching up now. And also, some of the main reasons for the anyway, Ahalya is going to speak more about that, mainly about this lack of love, or maybe because of the people want to have some variety, especially men, and also maybe because they are traveling a lot and working together. Now the software has come and more people are working night shifts and odd hours and lot of stress. And there is another thing which I have noticed is what is called micro cheating. It doesn't mean that it is full infidelity or extramarital relationships. It is a micro cheating where there may not be sexual contact, physical relationship, but it is just filtering. So even that also, even some people sexual fantasies, some spouses may not even accept this, but some studies have said that even sexual fantasies are good for to maintain a healthy sexual relation between husband and wife. when one of them have got sexual fantasies. So there are so many issues in that. And I think without taking much time before Ahalya is going to speak, let us see what she is going to speak on the husband and wife relationship, extramarital relationships, and also the other family relationships. What are the ruptured relationships and how she is going to give us some suggestions how to heal these ruptured relationships. So I think over to Ahalya. Everybody is waiting eagerly to listen to her. And again, at the end, we'll come back, both myself and people, for some concluding remarks. And then we'll have some question answers. And you can put your questions in the chat box. And Amrit is there, Alim is there. And all of us will try to answer your questions as far as possible. Over to Dr. Ahalya.
And you have 40 minutes for a talk.
Yes.
Yeah. Thank you all for those very kind words of introduction, both formally as well as informally. I think there could not have been a more appropriate person to chair this session than Dr. Indla, because as he mentioned, when he was doing his MD at NIMHANS, I recall that he also happened to present a case from the Family Psychiatry Center in a general case conference. I wonder if he remembers that. It was late
Yes.
Professor Dr. S.M. Chanbaswana. Of course, the details of that case now elude me, but I know that with his guidance and with his interventions, the case did have a happy ending. It was, I think, some issues between, the typical Indian scenario of a mother-in-law and daughter-in-law. So, as I said, there couldn't have been a more appropriate person to share this.
Just a small break. See, I thank you for reminding me. I still remember that was the day when I was working in family ward, and that was the problem between the mother-in-law and daughter-in-law issue that were admitted. And that is the day when I was presenting the case. The headlines, all newspaper headlines were Indira Gandhi throwing Maneka Gandhi out of the house. That was the headline. It coincided that day. And everybody was mentioning, the chairpersons and others, Kapoor and Chanbaswana were mentioning about that. So thank you for reminding, which happened about 40 years back now. Thank you. Yes. Okay, please go ahead.
That's right. Yeah. So we know that ruptures in relationships keep happening because it is a part of human nature. So today, what I would try to do is to focus on some specific aspects of the ruptured relationship. As the chairperson has mentioned, I would like to focus primarily on the extramarital relationships and offer some perspectives about what are the issues involved in extramarital relationships, how do we understand its impact, and what are the interventions that are possible, and what are the challenges that might also come up during the process of our interventions. To begin with, just to get a sense of what could be the scope of this problem, is there a need at all to focus on this issue currently? In one of the surveys that was carried out recently, based on about 1,500 married individuals in India, it was reported that about 55%.
Madam, will you please go to the full screen view, slide show view?
Sorry?
Slide show view.
Okay, right, yeah. Yeah, so it was reported that at least 55% of married Indians have been unfaithful to their partner at least once. And again, as Dr. Indla had mentioned, it's surprising to note that there were relatively more women who reported being unfaithful. Of course, this could also be that perhaps men are a little bit more reluctant to admit it, and women might be more open and willing to talk about it. 48% of Indians also believe that it is possible to have two relationships simultaneously. Now, this came as a bit of a surprise to me that about 2 years back, there was a site that was introduced in India, which was specifically devoted to extramarital dating. The figures that I quoted previously were based on a survey carried out by this particular site. Therefore, the figures, although they might seem a little alarming, if we say that 55% of people who are in marriages have been unfaithful to their partners, then that is almost half the population of people who are married, which is somewhat alarming. But we must remember that these are um, figures that have been taken from perhaps those individuals who have been frequenting this particular site. So, in that sense, it's not really a very representative picture of the population at large. It's also interesting to note that a huge surge in these numbers has been reported during this lockdown period due to the COVID. To give a more realistic account, in one of the studies that was carried out by my student on individuals who were going through a process of divorce, she interviewed them when they were visiting the mediation center set up by the Bangalore Family Court. And in that particular sample, it was reported that about 38% of the sample had cited extramarital relationships as being one of the reasons for which the couple had decided to separate. Also, extramarital relationships was one among the top 5 reasons that were given for these couples applying for divorce. So, to that extent, yes, extramarital relationships as a problem does exist. It is like the elephant in the room. Everybody is aware of it. Its magnitude is probably larger than what we are aware of or what we are willing to acknowledge. And it is not something that can be wished away. Most therapists who practice couple therapy would be aware of the fact that in quite a sizable number of their of the couples who seek help, extramarital relationships is often cited as one of the reasons for which they seek help to resolve their marital problems. So we move on now to what is it that draws people into extramarital relationships. Firstly, uh, is the factor of the novelty of engaging in a relationship outside of a known and a familiar relationship. So the curiosity and the excitement factor operates. This perhaps may characterize some individuals who perhaps may be somewhat high on the personality dimension of sensation seeking, people who are prone to indulge in risky behaviors and so on. But for many, often they are drawn into an extramarital relationship, which might initially start off as a friendship, but within that relationship, if the person with whom they are sharing important aspects of themselves or of the maybe the problems that they are experiencing, this relationship might offer them an enhancement of their self-esteem. It might perhaps offer them companionship and understanding, which they might feel is missing in their marriages, and a sense of validation for their feelings, for their attitudes, or for their thought processes. And beginning with this kind of a relationship, a platonic relationship, it might then grow into a much stronger a much more deeper emotional relationship, which might take precedence over the primary marital relationship. Then, again, this has been alluded to, in these days, many times extramarital relationships occur in the context of career advancement. Now, this has been talked about fairly openly with regard to some professions, particularly, for instance, in the film world, it has been referred to quite often in the sense that people who wish to advance their careers either are willing to get into an extramarital relationship um, as a way of getting ahead, or in other professions as well, such as has been mentioned, the IT profession, but it could perhaps occur in almost any other profession. The most important aspects, of course, um, which draws people or drives people into seeking a more fulfilling relationship outside of their marriages, can be attributed largely due to the pre-existing marital or sexual or emotional dissatisfaction that they experience in their marriages. So, how do we actually understand what constitutes an extramarital relationship? In the first place, it includes either a sexual or an emotional relationship or both occurring outside a primary committed relationship. The most important thing that characterizes this extramarital relationship is that it involves a breach and a violation of trust, and a violation of some of the agreed upon norms and rules of the marriage. Many times, these norms and rules are perhaps implicit in the relationship. They are not really spoken about very explicitly, but it is assumed and understood. And these extramarital relationships violate those norms, as and of course most importantly the trust, and most importantly, the one aspect which it violates is the fact that the marital relationship is meant to be, or is presumed to be, an exclusive relationship between two people. And that aspect of exclusivity is violated when one partner enters into an extramarital relationship. So, as I've mentioned earlier, these relationships might be either primarily sexual, where there is not much of an emotional investment or attachment to the person concerned, or it might be, in some instances, a purely emotional relationship with no sexual involvement at all, or it could be both. Some extramarital relationships might simply be an impulsive, one off kind of a relationship, which happens once in the lifetime of that particular marital relationship. Or it could be multiple casual relationships in which some individuals may engage in repeatedly over a period of time. Again, in these instances, these relationships are more likely to be predominantly just sexual in nature, with very little of the emotional component being involved. And then, lastly, we also have the online relationships involving infidelity. Now, this is something that is emerging as a problem in these times. Online infidelity, of course, there were some questions that were raised as to whether a relationship that occurs on the online platform, should it be considered as amounting to infidelity at all, since it doesn't really involve a direct actual physical contact between the individuals concerned. However, if we look at the understanding of what constitutes infidelity, one of the things that characterizes the online relationship is also the fact that these relationships are again generally shrouded in secrecy. They are kept out of the knowledge of the partner. They occur clandestinely, and it involves the same degree of violation of trust and the same aspect of violation of the exclusivity of the relationship. So, in all these characteristics, it is very, very similar to the actual physical extramarital relationships that might happen in a direct face to face kind of a contact. The other thing is that again in online infidelity, it many times it also includes what is called the sex chat, or the couples who engage in chatting about very explicit sexual matters, and that also then comes into the picture and constitutes the online infidelity. So once this has occurred and it has been identified by one of the partners that their spouse has been engaging in this kind of a relationship, what are the responses that are generally seen? In the betrayed partner, quite obviously, there are feelings of anger and rage. There are feelings of having been abandoned. There's a sense of rejection, and most importantly, there is a significant blow to the person's self esteem and self worth. And all of these emotions can sometimes present even as depression or symptoms of PTSD. In the partner who has been unfaithful, there are often feelings of guilt or embarrassment, sometimes anger, maybe anger at having been discovered in this extramarital relationship, and sometimes depression. All of these can occur to varying degrees and with varying levels of intensity, and that in turn can have an impact on not just the relationship but also the individual level functioning of the partners involved. When we attempt to deal with the extramarital relationship, the assessment of the problem, it is very helpful to begin with a conjoint first session, which can then be followed by individual sessions with the couple. Now, why is it helpful to have a conjoint first session? This is because it gives the therapist a good opportunity to understand firsthand and to observe firsthand what is the nature of the interactions and the nature of the communication that occurs between the couple on this issue. It gives the therapist an opportunity to understand, of course, and to observe what kind of emotions are being manifest by both. For instance, is the unfaithful partner being defiant? Is the unfaithful partner being very defensive in his responses? Or does the person appear to be willing to accept responsibility for the action? And does the person show genuine remorse and a willingness to work on improving the relationship? All these are observations that that are very helpful to observe firsthand, and which is possible when the couple are in the session together. This can then be followed by individual sessions where the therapist might need to obtain information in order to help them understand other aspects of their relationship which existed even prior to this particular extramarital relationship interfering. Firstly, what is the kind of emotional salience or importance that they attach to the marriage itself and to the relationship between them? What is the strength of the bond, the emotional bond that exists? Very importantly, it is important to explore the degree of sexual satisfaction of the couple and how openly are they able to communicate different aspects of their sexual relationship openly and frankly with each other. What are some of the personality attributes so that it might help us understand whether there is scope for making reparations and scope for bringing about a reconciliation, or are there certain personality factors that are likely to interfere with this process? The early developmental history of both individuals, particularly focusing on what kind of intimate relationships have they had in their adolescent years or in their early adult years, are important, as well as their attachment patterns. What styles of attachment have they had? Because it is known, it is well understood that the kind of early attachment patterns often form a template for the adult relationships. So, if the early attachment patterns themselves have been of a very insecure nature or of an avoidant nature, these are likely to be repeated again in the marital relationship. What is of great importance to help us in some ways for the therapist to predict whether the therapy is likely to be helpful or not is to understand what are the motives, what motives do the couple give, what are they able to think about for them to continue to remain in the marriage even after such a deep rupture has taken place. And it is based on the therapist's understanding of these motives that the nature of therapy can also be decided upon. Very importantly, the therapist needs to also gauge what is the capacity for empathy that is present, that they are able to gauge in both partners. This is again something that is going to become important for the process of healing the relationship as the therapy progresses. The impact of the disclosure in many ways follows the same kind of pattern as one might see when there is the loss of a significant relationship. So, the pattern, as you would see, is very similar to the grief process that occurs following the loss of an important relationship. These processes are, I think, familiar to many of you. The initial stage of shock, denial, and anger, then uh, which can then also go on to depression and disappointment, followed by a dialogue and bargaining. Um, in a sense, the emergence of the extramarital relationship out into the open in some ways is a process of grief, because to the partner who has been betrayed, it does represent the loss of an important relationship, the loss of an important intimate relationship in which they had placed all their trust, and there was an expectation of fidelity from that particular relationship. The intervention will actually be determined by the needs of each partner, and this is something that can be determined in the individual sessions with each partner. We need to keep in mind that as a therapist, the aim does not always have to be to ensure that the couple come together and remain in the marital relationship. Essentially, the therapy has to be driven by what are the needs that each of them express. Many of the individuals who are in this kind of a situation might decide that there is no scope of bringing about any kind of a reconciliation. This might happen particularly if um, the extramarital relationship has happened once, or even if it has happened for the first time, a couple might decide, or one partner might decide, that it is not possible to forgive the partner and to move on and bring about a healing in the ruptured relationship. And therefore, they might decide that the best option would be to end the marriage. In which case, the focus in therapy really be how can a separation be facilitated in a way that causes the least degree of emotional and psychological harm and damage to both individuals. However, if the couple decide that they would like to continue in the marriage, then the focus of the therapy would be on forgiveness and reconciliation. I will be focusing a little bit in detail on forgiveness as such, because this is one of the most crucial and key components in bringing about or providing the healing touch to most ruptured relationships. And again, as the chairperson mentioned at the beginning, the dimension of forgiveness is something that can be applied to many relationships that have undergone some kind of a harm as a result of betrayal or loss of trust. I will come back to it a little later. Um, Forgiveness is beneficial for both partners. It is important to remember that it is not just something that benefits only the person who has been unfaithful. Forgiveness is beneficial even for the person who has been betrayed, because it is through forgiveness that they are also able to work through the feelings of anger or sometimes even rage that they might be experiencing. And again, as mental health professionals, we are all aware that harboring or repressing anger and containing it within an individual over long periods of time is definitely detrimental to both physical as well as the mental health of the person. This facilitates also cognitive, affective, and behavioral changes in both partners. It brings about changes in the way in which the couple perceive each other. I've already mentioned about the kind of emotional changes that are facilitated. And as a result of both these aspects, both the cognitive and the affective changes, this will then translate into behavioral changes that can occur in their day to day lives. And this is the one thing that will help to re-establish more meaningful relationships as well as self acceptance. In a sense, both the betrayed person as well as the unfaithful person both suffer to some extent some damage to their self esteem. And it is through the process of forgiveness and healing that the enhancement of self acceptance and healing can be fostered. The unfaithful person, for instance, might have to come to terms with the fact that yes, they have been capable of betraying the, the trust of someone who had reposed complete faith and confidence in them. And that is something, a less desirable aspect of themselves that they need to come to terms with and to accept it as being a part of their personalities and of themselves. The person who has been betrayed, as I'd mentioned, experiences a severe blow in terms of a sense of losing confidence in themselves, losing confidence their in their self-esteem, and in what they believe is their capacity to hold the interest and attention of another person, their attractiveness to another person's. All these things are damaged when the extramarital relationship occurs. And regaining self-acceptance in all these dimensions is something that is facilitated in the process of therapy through forgiveness. However, there's a caveat here. We need to remember that the act of forgiving the unfaithful partner does not in any sense imply that the act itself is being condoned or it is being denied. In fact, in the course of therapy, this is something that has to be center staged, that has to be faced squarely by both the partners, and it has to be dealt with in an open and frank manner. Forgiveness can be facilitated by these four dimensions of empathy, humility, apology, and commitment. And I would like to just uh, spend a few minutes in talking about this. The dimension of empathy is extremely important because in the course of therapy, the partner who has been unfaithful has to be able to empathize with the feelings of hurt or rejection or the sense of betrayal that the betrayed partner feels in this context. And likewise, as the therapy progresses, the betrayed partner also needs to be able to feel empathy for the efforts that are being made by the unfaithful partner to change and to recognize and accept that genuine efforts are being made to bring about a reconciliation. So, empathy is something that is equally important for both. The second aspect is the humility, and this is something that is extremely important, but perhaps also the most difficult. The betrayed, the partner who has been unfaithful has to be able to take on a one down and a position of humility and humbleness. This is necessary before the forgiveness can happen. Um, this humility is not easy because none of us would really like to uh, take a one down position and accept. In private, we might accept many things about ourselves, but in the presence of others, most people would find it extremely difficult to accept that, yes, what they have done was wrong, whether it morally or ethically or in other sense, and to accept that there were no extenuating circumstances, that they alone were responsible for it, is something that can be a challenge for the unfaithful partner, but it is necessary for them to be able to adopt this particular position before the reconciliation and the forgiveness can happen. It is also important that this is not done in just one session or two sessions. It is an attitude that perhaps needs to continue for some time in the relationship until such time as the couple are able to go back to perhaps a more usual or a normal level of their functioning that existed prior to the breakdown of the relationship. And that's why I said that it can often be a challenge. Um, the next aspect, which is really the core of this whole intervention, is the apology, where the unfaithful partner apologizes with sincerity that the act that they have committed was wrong and that they have been guilty of violating the trust of the individual concerned. Now, I'm emphasizing this again because you see, in most instances, when we know that we have done something wrong, and we are put in a situation where where we have to offer an apology to someone, the way in which it is usually framed is, if I have hurt your feelings, I'm sorry for it. In this situation, there can be no question of if I have hurt your feelings. The starting point should be a recognition that, yes, I have hurt your feelings and I am genuinely sorry about it. I regret having done that. Okay. And there can be no riders or no qualifying statements to this apology. This also implies that the person takes full responsibility for their actions and does not offer any other circumstances or does not offer any other rationalizations or explanations to, in some ways, um, reduce the impact of the act itself. And then finally, forgiveness can also be facilitated in some ways if there is a commitment to the relationship from both the partners. So, the kind of hope and commitment that the partners have about the relationship, the hope that they have about attaining certain common goals, are important. For example, if the couple has children, and if both of them are concerned about the welfare of the children and the impact of the strained relationship on the children, sometimes this can bring about a stronger sense of commitment towards making the relationship work. And with this commitment, the couple are then able to see themselves as being partners rather than as two separate individuals, and two partners who have both a psychological as well as an emotional attachment, a strong psychological and emotional attachment to each other. So, whatever I've said may sound fairly simple, but in actual practice, getting the unfaithful partner to actually carry these things out in the course of therapy can often be quite difficult. And so, there are several barriers that might come up. For instance, daily life events can often trigger memories of the betrayal, even as the couple is trying to work on restoring and trying to work on getting back to a more normal relationship or to a relationship as it existed earlier. There might be some, sometimes even very trivial events, which can trigger memories of the betrayal, and which in turn can then once again trigger feelings of anger or sadness, the sense of insecurity. Therefore, this whole process of bringing about a reconciliation is often a long and difficult process. I might also add that, though I mentioned that this aspect of apologizing needs to happen, it's important to emphasize that the apology, it is not sufficient for the apology to be just offered once and for the unfaithful partner to feel that, yes, now I've apologized, now we need to move on. It is not as easy as that. The apology may have to be made multiple times over a period of weeks or sometimes even months with the same degree of humility, and um, it is, and it therefore demands a tremendous amount of patience and an ability to persevere in working on the relationship. So some of the things which facilitate the act of forgiveness are, first of all, if both parties are committed to the therapy as such, then yes, definitely the act of forgiving the partner and working on bringing about a reconciliation is perhaps facilitated. The therapist has also to be prepared, and likewise, the partner also has to be prepared to handle sometimes crises that may emerge during during the course of the therapy. For instance, as I said earlier, if there are some events that trigger painful memories of the betrayal, then it might lead to certain painful or intense emotions being experienced, which in turn might precipitate acts of attempted self harm and so on. And these are things that the therapist and the partners need to be prepared for, and must also learn how to deal with these things. The um, if the couple prior to the act of the extramarital relationship has had a strong and a fulfilling emotional relationship with each other, this is also then likely to facilitate the reconciliation process. And most importantly, if the person who has been unfaithful, the unfaithful partner is willing to immediately bring about an end to the ongoing relationship, that is something that is helpful in terms of the forgiveness. So coming over to the what are the different stages of the therapy? Firstly, dealing with the impact of infidelity. So, in the immediate aftermath of the discovery of the fact that one's spouse has been engaging in an extramarital relationship, it is important to set to have a discussion with both the partners in terms of limit setting. The initial period can be characterized by a great deal of anger, a great deal of hostile feelings towards the unfaithful partner, constant blaming, and so on. And this in turn might trigger off a number of negative interaction sequences between the partners at home. Therefore, the therapist must be able to first set some limits on um, the kind of negative interactions that can occur and try to minimize these to the extent possible. The betrayed partner, or for that matter, both partners, might need to learn techniques such as timeout, as also being able to give vent to their feelings and to their emotions in ways that are not likely to be destructive. And this can be done by helping both individuals to focus some attention on self care, either through seeking social support or through spiritual support, and also helping them in terms of how to deal with flashbacks if at all these things occur. In the next stage of therapy, this is really the stage where the individual, the betrayed partner, tries to make sense of what has actually happened. Because the question that often arises is, why me? Why did this have to happen to me? And what is it that I was lacking? Or what is it that I did wrong in our relationship for this to have occurred to me? And therefore, the therapist needs to focus and help the individual to find a meaning and to make sense of what has happened and to come to terms with it. This can be done by facilitating an exploration of what were the factors that could have contributed to the affair. Was there something that was missing in the couple's relationship prior to the initiation of the affair? Um, Also, again, it is important to explore openly and honestly what are the characteristics of the participating partner. What is it that was attractive about the other relationship? What is it that that relationship offered, which the individual felt was missing in their own marriages, and which therefore attracted them towards that? And like I said, some of this exploration perhaps is easier in the individual sessions with each of them, where the couples can perhaps be more frank and more open and honest in talking about it. But at some stage, having understood what are these different dimensions which had contributed to this relationship, it is important to subsequently bring this back into a discussion with both the partners being present. The common issues that the therapist might encounter at this stage are a resistance in terms of accepting responsibility. And again, I would emphasize accepting responsibility by both the partners. The unfaithful partner might evade responsibility by, blaming the person with whom he has had a relationship, he or she has had a relationship, and might say that it was that person who drew me into this, or that person made threats and so I could not get out of the relationship, or various such factors might be attributed. On the other hand, the person who has been betrayed might also find it difficult to take responsibility, to acknowledge that maybe everything was not right in the marriage, even prior to the extramarital relationship having started. And that is where the resistance might be seen, coming from both partners. In terms of acknowledging what were their roles in the relationship having reached this stage where one individual felt the need to look for some kind of a gratification outside of the primary relationship. And the other difficulty that can come up at this stage is the lack of empathy, where each partner might find it very difficult to empathize and understand the point of view or the perspective of the other partner. The third phase of the therapy is really the one that is focused on the future in terms of rebuilding the relationship. This is, of course, again, a very difficult stage, because if the couple has understood or they have come to accept what were the reasons why their marital relationship broke down and so on, still, for the person who was betrayed, for them to regain trust in the partner is perhaps one of the most difficult thing. And it might sometimes be frustrating to the unfaithful partner that no matter how many assurances they give, their spouses don't seem to be convinced, and they still keep doubting them or questioning them, or monitoring their activities or monitoring their phone conversations, checking their emails, the chat accounts, and so on and so forth. However, this is something that the therapist has to normalize as a process that takes time and therefore is going to require patience and perseverance. If the couple have decided that they are not willing to stay together any longer, then sometimes the idea of forgiveness, if they have decided to separate, then becomes difficult. The betrayed partner might feel that the one way of punishing the person is to not forgive them, to make them feel constantly guilty, even if they don't any longer wish to live together with them. So, what are some of the factors that indicate that the intervention is likely to be helpful in bringing about a reconciliation? One, first, the important one, what was the degree of marital satisfaction prior to the extramarital relationship? And in general, if a good um, and a satisfying relationship existed, then the chances obviously are much better that the entire relationship is not likely to come to an end as a result of the extramarital relationship. A higher level of commitment to each other and adherence to shared goals. One of the commitments or the shared goals which a couple might have, as I mentioned, could be the presence of children, and their investment in the children's future might often be a very strong motivating factor to drive them into trying to uh, rebuild their relationship. The ability to discuss issues openly, how open they are, how frank and how emotionally honest they are in the sessions can again be a good indicator to say that the outcome is likely to be favorable. And of course, if at an individual level, if each of them has healthy patterns of coping, this is a situation where often people can resort to unhealthy patterns of coping, such as, for instance, excessive drinking or other forms of unhealthy coping that might be present. So, if the couple basically has healthy coping mechanisms to begin with, it is likely to see them through this difficult phase in their relationships. Um, I'm almost nearing the end of my presentation, but I'd just like to give two quick case examples of situations where extramarital relationships was the focus of therapy. The first was a case of a couple, um, well-educated, um, well-educated professionals, both in their 40s, who sought help because the wife had discovered the husband um, had engaged in an extramarital relationship. Um, in the course of therapy, it became apparent that um, this was not the first time that it had occurred. This was probably the second or the third time that the husband had engaged in an extramarital relationship. And what made it most difficult for wife was the fact that the person with whom her husband was having a relationship was her own younger sister. Now, the first time she discovered them um, engaging in this in a physical relationship, the husband was able to convince her, saying that it was a very impulsive thing, it was unplanned, and he promised never to repeat it again. But then she discovered later on that it had happened at least on one or two more occasions, and on both these occasions it appeared that the relationship had been um, well planned. um, both of them had planned for a time to meet, a different place to meet where the chances of discovery would be less, and so on. So obviously, it was not an impulsive act anymore. It was a very deliberate, planned affair. And that was something that hurt her very, very deeply. It also hurt her a great deal because of the fact that it placed her in a very difficult situation, because being her own sister, there were very few people with whom she could actually confide or talk about this relationship. She did tell her parents about it, but in a sense, it virtually cut her off from her own family, because she did not want to attend any family functions where her sister would also be present. She also didn't want her husband to attend any of these family functions anymore. And she didn't want to go alone because there would be questions about why he had not accompanied her and so on. So, in a sense, even her primary support system of her family was denied to her as a consequence of this affair. Um, One of the other things that was also happening when all this was discovered was that this couple were in the final stages of adopting a child, since they had been unable to have a child of their own. So in therapy, which happened spread over perhaps 2 or 3 months, um, what was remarkable was the fact that both of them were able to talk about and acknowledge the issues very openly. One of the important things that led to a reconciliation between them was the husband accepting and owning responsibility for his actions, and the fact that he was willing to accept and deal with the wife's emotional upheavals, which took a long time to actually resolve. She, in fact, went through a period of depression where she required medication and so on. But he stuck with her all through. During this phase, when she was going through all the emotional upheavals, there would be periods of time where she would, of course, constantly blame him and fight with him. And he very patiently handled all those kinds of situations. And in a sense, this helped to bring about a reconciliation. But also the fact that I mentioned earlier, the commitment that they had to a shared goal, the fact that they were ready now to adopt this child, and both of them were very particular that that aspect of their life should move forward. That also helped to move them towards a reconciliation and to carry on with their lives. The second instance was a couple where they were a slightly older couple, both were in their 40s. They had two children, both grown up, um, who were adults themselves. And here again, the wife discovered the extramarital relationship of the husband. Now, in this instance, it was very, very difficult for the wife to move beyond the phase of blaming and venting her anger towards the husband. She, in fact, went through a phase, or she could not, in fact, move out of constantly checking the husband's phone all the time, all his emails. And in fact, she went to the extent of somehow being able to obtain the call records of her husband. And she would go over these call records repeatedly. And no matter how many times the husband tried to convince her that he had broken off the relationship and so on, it would not convince her. There was almost a kind of an obsessive quality to her checking and her compulsion to keep monitoring his activities and checking the records and so on. In their case, the commitment to stay on in the relationship again was not very strong. Since both the children were now adults, the wife did not feel that she needed to stay on in the marriage any longer. And therefore, after a period of time, they just decided that she would separate. She did not really want to go in for a divorce, but she just decided that she would separate. And thereafter, they discontinued the therapy sessions as well. Sorry. Therefore, untangling issues in a ruptured relationship is not easy. And as I have repeatedly mentioned in the course of this presentation, patience and perseverance is very, very important, both from the couple as well as from the therapist. On the therapist side, there are a few things that therapists have to bear in mind. One is to avoid the pitfall of taking sides or aligning with any one of the members. And this is something that can sometimes very unconsciously happen based on either similarity of age or gender or whatever of the partners. And the other is, what are also the therapist's own values and belief systems with regard to marriage, the sanctity of marriage? What are their beliefs about extramarital relationships and so on? And it is important that these values and belief systems of the therapist do not in any way influence what is going on in the therapy sessions. Um, it's most important that the therapist not take sides with the betrayed partner, because then you can have a situation where you have two people, the therapist and the betrayed partner, together attacking the unfaithful partner, and that is detrimental for the course of the uh, uh, therapeutic process. So, working through issues of infidelity, although difficult, provides an opportunity, however, for a more honest and mature relationship. So, although the couple may go through a difficult phase, if they are committed to rebuilding the relationship. It is possible, but it requires hard work. Coming to the final point, and that is whether these ruptured relationships occur in the context of other relationships. Yes, they do. It can happen in families, for example, between siblings, between parents and a child, or sometimes between very trusted friends or business partners. Many of these principles that I have outlined with regard to bringing about reconciliation are applicable for the healing of those relationships as well. However, when it comes to, you know, engagement in therapy, perhaps if it involves friends and colleagues, it may not be possible to involve them in therapy. However, the therapist can still choose to work through one individual, the person who feels betrayed, and help them work through this process wherein they overcome their anger and they are able to, in some ways, if they are, if they desire it, to bring about a reconciliation. If it involves other family members, sometimes yes, it may be possible to bring the father and children into the session or siblings into the session and more directly deal with it. So these the broad principles might remain the same and could certainly be applicable to these other relationships as well. Thank you.
Thank you. Am I audible? Yes. Yeah.
Yes.
Thank you, Dr. Ahalya, Raguram, and for the wonderful talk. I can understand. I know it is a very difficult task to speak on a subject like this. It is not so easy to speak like a management of refractory depression or schizophrenia, where we have got a lot of pharmacological aids and also other physical methods of treatment where we can help our clients. But this is an area where there is no drug to heal such ruptured relationships. It is mainly by your counseling and psychotherapy or CBT or whatever it is. But I think it is highly taxing on the therapist also, highly emotionally charged and highly taxing, and you should have a lot of patience on this. I think Ahalya, Raguram, both are inseparable. I think behind Ahalya, Raguram is there, both in personal life and also in their professional life. And behind Raguram, Ahalya is there. Probably the success story of these two, they are well-known speakers. Raguram on one side and Ahalya. So I appreciate both the couple, especially Ahalya, for this wonderful talk. And before we go to the question answer, just another few words. I think about 25 years back, when I was preparing for my psychology of love and sex, I used to read that men love for sex and women give sex for love. I repeat, men love for sex and women give sex for love. But those days, probably now the times are changing. I don't think the same old saying goes true even today, as the statistics say that the number of women also getting into extramarital relationship is increasing in the current context. And another one or two points before we go for the questions is there is another study on income and infidelity. So they have studied the relationship of earning of the one of the couples or both the couple. They said that if one spouse is earning, like the husband is earning, and our wife is only just a housewife, probably the chances of infidelity of the husband is much more, because he thinks that he is the boss and nobody can dictate, and the wife is just dependent. Probably this is another one point. Another thing they have studied the relationship between spirituality, religion, and infidelity. Of course, I am not speaking of some of the fake gurus and fake babas or swamijis, but in general, they have studied that people who are more spiritually oriented, who have got more ethical values and other things, probably there the infidelity rate is much, much less. That is another finding they have studied. And coming to another few last points, what is the importance of this infidelity to our psychiatric disorders? Of course, most of us are psychiatrists in this session, and a few points on this. For example, bipolar 1 and bipolar 2, where there is a lot of risk involvement. They take risk and they get easily involved. They are highly increased psychomotor activity and lack of inhibitions. They easily fall prey for the extramarital relationship. So this is another thing we have to keep as a clinicians in bipolar disorder. Another thing is in personality disorders. What are the various personality disorders where these extramarital is very common. One is the ASPD, antisocial personality disorder, where they don't have any morals or ethicals. They don't conform to the social norms. And other thing is borderline personality disorder, where there is a poor impulsivity. Suddenly they get into emotional or sexual attachment. Another thing is histrionic personality, lot of attention seeking and other things. And another thing is narcissistic personality also, where they think that constant appreciation need to be appreciated, and they feel very high of themselves. So this is another personality where they are also more prone for this extramarital thing. Gender dysphoria is another thing. Of course, even paraphilias or sexual addictions. These are some of the other diagnostic categories where people are more prone for extramarital relationships. So then substance abuse. In substance abuse also, the incidence of involving in extramarital relationship is much more. Of course, with these few points now, I think Dr. Vipul is there, Dr. Alim is there, and Amrit is there. Probably there are so many, I'm seeing in the chat box, so many questions are pouring in. I think Ahalya should have a lot of patience to answer most of these questions. I think over to Vipul, Amrit, and Alim, and to see how best we can justify all our viewers, our colleagues, to get their questions, queries answered. Please take on.
Thank you, sir. Thank you so much, sir. Sir, can we have a permission to maybe extend it by till maybe
Sure.
9:45, 9:50? Madam,
Sure,
are you okay
sure,
with it?
absolutely. Very
Okay,
interesting.
no problem.
Madam.
Yeah.
Sure, sure.
So, madam, thank you so much for this talk. But one question that always remains is, how will the children heal, sir, madam? You know, what will we do about the children? We are worried about the perpetrator of whatever has been done. We are worried about somebody who has been affected, but I think the kids are the worst affected. What should be our stance? How do they actually heal? There's two or three questions on this, madam.
Yeah. Yes, that's an important aspect. It really depends on what is the age of the children that we are dealing with. Because if there are very young children involved, perhaps they may not be able to understand the, to basically understand the difficulties that the parents are going through. With older children and adolescents, definitely they are in a position to understand that their parents are having a difficulty. In which case, if the couple has decided, whichever way it might be, whether to separate or to stay together, it is important for them to also sit down and have an honest and open discussion with the children. If required, the help of the therapist can also be taken in terms of bringing them in to the therapy sessions as well. Most importantly, both the parents need to learn how to manage their own emotional upheavals during this phase when they are working out what decisions they are going to make, so that their emotional turmoil does not have an impact on the children. So yes, grown up, older children can definitely be brought in within the ambit of therapy.
Yeah, thank you, ma'am. Ma'am, there is a very interesting comment in the comment section. Role of therapist would be facilitating reunion or facilitating separation, and how do we go about it? How would you write that?
No, it's not that the therapist, if the couple make the decision, right, if they have decided that it is not possible, for example, in the second situation that I described, the couple made the decision that it was no longer possible for them to live together. The wife did not feel the need to continue living together with with her husband. So once the decision has been made, the couple can help them, the therapist can help them, bringing about a somewhat smooth ending to the relationship. And this is often referred to as divorce therapy. Yes, there is a lot of anger, but if both of them continue to just exchange a lot of anger and blaming in the sessions, right, that is actually going to have destructive consequences for both of them. So here the focus of the therapist is, yes, you have decided to separate. So how can you work together to make this process of separation as smooth and easy for both of you? Okay. And in this context, yes, the needs of the children, the financial aspects, all those aspects are to be talked about and negotiated and agreed upon. So that's what I meant when I said to facilitate the separation.
Another important aspect, madam, is, and it's a very important aspect, maybe not in a place like Bangalore or maybe in a place like Delhi or Mumbai, but in the tier 2, tier 3 cities. Can the therapist's sexual and marital belief in morality hinder the therapy? Because I see a lot of issues coming out of it.
Sorry,
Can the therapist's sexual and marital belief in morality hinder the therapy?
Yes, definitely. And that's what I mentioned in the towards the end, that the therapist's value system, their attitudes and beliefs, right? That is something that cannot be allowed to, interfere or influence what's going on in the therapy. That's an important requirement. Okay. So, let's say a therapist might feel that no matter what, and this is a very common belief in our country, no matter what, no matter how difficult the situation is, the wife must remain quiet, the wife must remain submissive, or the wife should make all attempts to somehow bring about a change in the husband. And this is a myth that is often perpetuated, that if the wife is, because so many of our television serials unfortunately also have this as their theme, that if you have a wife who is very patient, who is who puts in all her effort, she can somehow or the other bring about a reformation in the husband, and then ultimately there will be a happy ending. Now let's say the therapist has this kind of a belief, right? But ultimately it is left to the couple to decide what is it that they want to do. And in some ways, for the therapist to transmit this belief to the wife that yes, it is your job to bring about some kind of a change in the husband and so on, that would not be right, because that would be placing an additional burden on the wife when she has to already struggle with, the unfaithfulness of the husband.
Ma'am, one of the important things that you talked about was forgiveness.
Hmm.
So the $1,000,000 question would be, how genuine is the apology? It has been mentioned in the chat box also. How genuine is the apology, and how to go about this aspect?
See, there is no way by which you can measure or gauge how genuine it is. Um, it is for the person who is giving the apology to be, if they are really sincerely interested in bringing about healing in the relationship, up to them to be as honest and sincere about it. Now, whether that is sufficient to convince the other partner is an open question. It might so happen that, and it is in some ways dependent on how well or how emotionally tuned are the couple to each other. If a couple have lived together for 10 years or so, in many instances each one can kind of predict or guess what is going on in the other person's mind, or they can gauge how sincere is the other person being. Okay. So it is up to the person who is receiving the apology. If they feel convinced about the sincerity of the apology, that is really the ultimate test. uh, Frankly, it is something that only over a period of time the person will be able to decide whether it in fact was an honest, sincere apology. Because if it was genuine, then the actions will also be congruent with the apology. The future actions of the partner will be congruent with that. Whereas on the other hand, if it was, something just for the sake of, um, you know, patching up things for the time being, it is hard to then maintain that, and the action sooner or later will give rise to doubt and suspicion and so on.
Another important question, madam, and that has always struck my mind also when I deal with cases of infidelity, and we see maybe 4 to 5 cases every day. So how can we check the tendency of a free pass that the spouse of offender sometimes adopts, which makes them absolve themselves of any responsibility, where the offender is all at fault? So how do we take care of such situations? Suppose the husband is the accused and the wife is blaming him for everything, absolving herself from it. So how do we deal in these cases, madam?
See, that is why it is important to have some individual sessions with each of them. A lot of this blaming and constant blaming of the husband and holding him responsible for everything could be a manifestation of the anger at having been betrayed. Okay, and so some time needs to be given to this betrayed partner to work through that anger, to overcome the anger, and so on. But once they're able to move past that somewhat, and it is there that I also mentioned that the self-care techniques become important simultaneously for them to deal with these negative emotions, whether it is anger or jealousy or depression or whatever. It is also important for them to adopt other measures of self-care. It could be anything, engaging in maybe a program of physical activity or spiritual practices or meditation or anything else that might um, help to help them cope with their disturbed emotions at that point of time. But once they're able to move past that, it might then be helpful to get them to start thinking about whether there could have been something in their interactions that is between the couple which could have set the stage for this extramarital relationship. Now, this is something that has to be carefully handled because in no way should the therapist convey to the wife that, look, you were also at fault and that's why this happened. Okay, that's not the message that you want to get out to the wife at all, because in this instance, yes, the betrayed person is the one against whom there has been some hurt or some breach of trust that has been inflicted. Okay, and so she is definitely the injured party in this. He or she is the injured party in that sense. But for the future of the relationship, it is important to get them to examine, could there have been some aspects of your personality or of the interactions between the couple or anything else which maybe could have acted as a contributory factor, not the primary reason for the extramarital involvement, but could have further facilitated or contributed to it.
Yeah, thank you, ma'am. Ma'am, you mentioned some good prognostic factors that if it is a stable marriage, you have other things. So if it is if a couple already has good prognostic factors, uh, is one of the person less likely to go towards this extramarital and infidelity issues?
um, See, it's hard. It is, you see, the fact that they have a good, stable relationship and so on is likely to reduce the chances of either one of them getting involved in an extramarital relationship. But the point is that many times marriages, you can have several situations where there may not be any overt conflict as such in the marriage. The couple may not really be fighting with each other on a day-to-day basis. There may not even be a great sense of dissatisfaction. But yet the couple might feel that, okay, you know, we have been married for so many years, we are getting along, and so on. In such a situation, when maybe there is an opportunity to get involved in a relationship outside of the marriage, as I said, in such a situation, the novelty factor or the excitement factor maybe can entice one person into getting involved in an extramarital relationship. But
So,
even general, if there has been a stable and a satisfying relationship, less likely.
So my monogamy is a society-induced trait or it is a biological trait? Monogamy versus polygamy.
See, monogamy, polygamy, all these are, I think, more of socially things that, society has introduced, isn't it? And there are, of course, some societies where polygamy and all are acceptable. Okay, so I really don't know whether we can talk about it in biological terms, more sociological and
Madam, I'll be digressing a little. We're
Yeah.
talking about extramarital relationship. What about premarital relationships suddenly being discovered? With the advent of WhatsApp, Facebook, and all that thing, suddenly 20 years back, relationships suddenly fructify at the age of 44, 45, and then they are caught. So how do we deal with certain things, these things?
You see, if um, the fact of someone having had a relationship maybe 10 or 15 years ago, and it has happened before this particular couple got married, how well they are able to deal with it really depends on what is the current strength and satisfaction that they derive out of this particular relationship. Now, if they have had a strong good bonding with each other and so on, perhaps the other person might be able to dismiss it of no consequence, because it is something that has happened even before they've gotten married, and it is something that has occurred in the past. If, however, and there are some couples who may say, oh, this so and so was not 100% honest with me, and this is a secret that has been kept hidden from me, and so on. Yes, there is maybe a small element of trust which was missing in the relationship, but I don't think that it would be so, again, in the context of a stable relationship, it would not be sufficient to bring about such a disturbance in the overall pattern of their relationship. Maybe there might be a temporary blip, so to say, but it's not something that, with some degree of honest communication and open communication between the partners, it's not something that they will not be able to resolve.
Madam, two questions related to this. Then Alimi will take up. Madam, one is I have seen a lot of strong relationships. Forgiveness there, everything is there. But when it comes to sexual relationship, they can't do it again.
Yes.
All
yes.
the aspects are covered up. But when it comes to the physical aspect of the relationship, it actually turns them off, and then the relationship they told everything. I've forgiven, I love her, I do everything. But then when it comes to the actual act, I just get out of it. So
Yes.
how do we handle such things, madam?
Yes, it is. An extremely important factor. In fact, the first example that I gave you, one of the most important difficulties which the wife struggled with was in terms of being able to resume the physical relationship with the husband, and in some sense, she literally had to kind of force herself to get back into resuming a normal physical relationship with the husband. Um, I don't know if there is much that the therapist can do about it, except to try and find out whether this inability to resume the physical relationship, is it occurring as a consequence of some ongoing anger towards the husband, anger towards the partner rather. Okay. And if that anger has still not been resolved, is the fact of not engaging in a physical relationship one of the ways by which the person continues to express that anger towards the husband, in which case the therapist might then have to bring the focus back onto dealing with anger. Now, again, at a cognitive level, the person might say, no, I'm no longer angry. But perhaps we might need to look out for other indications to say whether indeed, yes, anger is still there, maybe not at a very conscious level, but deep down still inside.
So should one disclose about the premarital relations to the would-be spouse? Many times people come to us and ask, should I, shouldn't I?
That
No,
really,
everybody wants the other partner to be honest, but are they strong enough? Are they man enough or woman enough to accept
exactly. You
the truth?
see,
So what do we do? That's a very important issue I always face.
I think it would be best to actually turn the question back to them. It all depends on the context of the relationship. If it is like an arranged marriage, all right, and I know that this has happened on several occasions, that somehow the first day after getting married, in an arranged marriage, when they barely know each other, they decide we have to start our life on a clean slate. So I have to disclose everything about my past. Okay, now the person, the recipient of that information may not be strong enough, might not be willing or ready to receive that kind of an information. Okay, so in some ways it is somewhat, I would say, premature to think of doing such things, until you have been able to establish a good relationship with that person. Okay, and even then, ultimately it is left to the discretion of the person. Now, if after living with that person for 2 or 3 years, they recognize that if I were to disclose something like this, right, my partner will not be able to handle it or take it. Maybe it is best for them to remain quiet and not talk about it. You know. On the other hand, if they feel that yes, we both share a very open, frank, and honest relationship, and if they feel that their emotional bond is strong enough, then yes, go ahead and talk about it. In which case, the other partner is also likely to deal with it in a manner that is not likely to damage their relationship. So I don't think you can have a very categorical answer to that, to say yes, it is good to uh, tell talk about your premarital relationships or not. It really depends on the context of the relationship.
Amrit, just for a small this thing, see about this point, many times I have seen in our practice that especially the first night, the husband telling the wife, I had one girlfriend before that thing, this thing like that. Then he will ask her, okay, come on, you tell me also your experiences, anything he has got like that. And the innocent girl thinking that the husband has revealed all his this thing, so she may also just say, yes, I have one boy, something like that. So the male ego doesn't accept so easily. And the minute she starts telling like this, and he will start blaming her, accusing her, and say that you are very unfaithful, and all these things will talk. So the best thing from my point of view is better not to disclose. Just keep quiet, whatever has happened. That's all. That is whatever has happened. That is before the marriage. Just close it and bury it. That's all, once for all. That is my
Thank you,
opinion.
sir. Halim.
Thank you, sir. Ma'am, there is a question: how to deal with an unfaithful partner who expects things to go back to normal very soon and labels the emotional outbursts in the other partner as overreaction? कि मैं तो सुधर गया हूँ, but the other partner is overreacting. So how to handle this issue?
Yeah. So that's what, like I mentioned, it is not something that can be set right within with some kind of short-term therapy. It is much like grief, how the process of grief resolves. You cannot say that I will have 8 therapy sessions or 10 therapy sessions, and at the end of those 10 therapy sessions the grief is resolved. Likewise, and as I mentioned, here also the process is very similar to grief. So the unfaithful partner needs to be patient, needs to be able to handle these multiple outbursts. And it can happen that over a period of time, yes, the intensity of the outbursts or the frequency of the outbursts may come down. There might be, let's say, 6 months of relative calm and peace, and then suddenly one day again there might be an outburst. Okay, the thing is that if the person is truly committed to preserving the relationship, they should be able to weather through all these. That's why I said it is a long and a difficult process, and it requires basic commitment to the relationship.
Okay. And ma'am, suppose at the other end there isn't a person. The problem in relationship is just at an emotional level. The one person is not involving spending time in other activities which are not related to another person. So how to handle this sort of relationship issue?
No, see, it is not that it is only those that involve a physical relationship that are to be considered as infidelity. If the emotional relationship is occurring outside the marriage, it will in some ways have a bearing and a reflection on the primary relationship, isn't it? In the form of maybe neglect or not spending time or not being appreciative of the partner, things like that. Okay. Not being supportive, being very distant and aloof, all of these kind of things might happen. And there also the person, the betrayed partner definitely gets the sense that I'm not exclusive in this relationship, right? There is someone who is more important than me, in which case the person really has to make a choice as to which of the relationships they would like to continue with. It cannot be that, I can simultaneously be in two relationships at the same time. That is in many ways not possible.
And if it is possible, madam, if somebody is able to devote time to the partner,
I
support the
don't know.
partner, as
I
well as in a
think
relation to another person, and the partner is not giving time, partner is not supporting, but partner is not in a relationship. How do we deal with such people?
I don't know. I think the person has to be really superhuman to be able to devote, equal time and attention and the same degree of emotional attachment and support to two people. And really, I find it a little difficult to uh, understand that.
Yeah, ma'am. Suppose if one
Madam,
partner wants separation, the other says no, don't want it. So how to go about in those situations?
That is, in fact, very difficult. It happens not just in the context of extramarital relationships. It very often happens even when couples come with just uh, the regular marital discord and marital problems, where one wants a separation and then the other wants to continue the relationship. Again, it might be helpful to really understand what is it that makes one individual want to continue in the relationship even when they know that their partner is not interested in continuing with it. Are they aware of what might be the future trajectory of their lives if this were to continue? Because the only way in which it is likely to unfold is with the person becoming increasingly frustrated or increasingly unhappy, um, in the relationship and so on. In fact, both of them, because if one wants to opt out and is being held back and constrained and so on. So here it is in some ways the therapist's job to bring the person who is reluctant, bring them around to accept and face the reality. um, Many times the reason why they might want to hold on to a relationship might be out of certain constraints that might be present, such as, for example, if they do not have sufficient financial means to be able to support themselves, they might want to continue in the relationship even though the partner wants a divorce, or they don't feel confident enough, or they lack support from their families in the event that they were to separate. So often these kind of constraints sometimes drive people to remain in relationships, even though the other partner they know is not interested. In which case, really, then the focus in therapy is to work on empowering them to feel confident and capable and competent enough to be able to manage on their own.
there's a question, madam. How far will it be correct to include online chatting or emotional support from some other than the marital partner to be included in preview of extramarital relationship?
You see, all these chats and conversations need not be considered as especially on the online medium, need not be considered as infidelity, so long as they are not secret from the partner. The problem arises when, it happens in secrecy, it happens clandestinely. The moment the person comes into the room, you close that particular window. If things like that happen, then obviously it indicates that there is something happening which you do not want the other partner to know. If there is an openness and an open sharing of whatever is going on, it is not considered infidelity. So yes, one can derive emotional support maybe from somebody else, provided the partner is aware of it.
But if the partner is not cooperative, so he or she is somebody who is very, very closed, who does not accept a opposite sex friend as a friendship, who, a lot of issues come up. It is not just about me opening up just because if my partner is averse to everything. I suppose somebody actually has a delusion of infidelity.
No, that's a different dimension altogether, isn't it?
Yeah, there's a question that's why I was asking. How to differentiate sometimes?
Yes.
Yeah.
When it comes to infidelity, sometimes it is very hard. But otherwise, if there is no delusion and there's no other psychopathology, right? One of the things you have to consider is, what is it that makes this person feel so insecure in the relationship? And is there something that they can do to empower themselves?
Yeah. So, ma'am, if I want to summarize it, there has been an extramarital affair, and now things are back to usual, and now the relationship is ruptured, and we want to heal the relationship. So the foremost thing is there has to be acceptance and then forgiveness. So we have to work around this forgiveness thing.
Yes.
Yeah, and then depending on the prognostic factors and depending on the input of the therapist, there would be some outcome which could be good or bad.
Hmm.
So in your usual clinical practice, what is actually happening? Can you run through us through this cycle as a sort of summary or take home point?
No, I didn't really get what is it that you
Ma'am, suppose
are looking for.
affair has occurred and now
Yeah.
the thing is back to normal.
Oh.
Now the unfaithful partner is saying, I'll not do it again. The other partner says that how long should the other partner wait before this initial reaction goes on? So this initial the sort of stages of grief that we talk about. So how long does it usually last? The initial outbursts.
No, that is variable. That would depend on, like I said, what are the strengths and vulnerabilities of each of the persons involved. Okay, and it is. I don't think you can have a specific time frame like that. Each individual goes through this whole process at their own pace. Okay, an important thing might be for them to have some kind of an ongoing contact with the therapist. It need not be at very very regular intervals, like twice a week or whatever it is. It can definitely be a lot more spaced out, but it is definitely helpful for them to have ongoing therapeutic support. All right, so that, as I said, it is not like a smooth process which will, when this happens and then there are a few therapy sessions and then everything gets smoothened down. It is more likely to be an kind of an up and down kind of a course, a roller coaster kind of a course, where yes, there might be periods where things may be going on quite well, quite harmoniously between the couple. Again, something might trigger off a period of difficulty between them, and before they come back again. So it will take time. See, once trust has been breached, for that trust to be regained and restored takes time, and I don't think you can really put some kind of a time limit on that.
Again, we'll take the last question. It's already 9:48 and Madam has been speaking for the last 100 minutes. So, Madam, last question is, that's a common situation we see where the male is the accused or the perpetrator of the crime. The female is a housewife with 3 kids. Male is he has no remorse. He's not asking for forgiveness. He's totally brazen. But then the female has no option but to stay in the relationship. She's all scarred. She's all sad. But then for the sake, she's sacrificed. So how do we deal in such cases? Where the husband knows that he can get away with murder also, and he has he takes no hostages. He does what he wants to do. How do we handle such situations?
Very difficult. My own personal thing would obviously be, to try and facilitate a separation between them, if it is possible. But then, as you're saying, that would be my instinctive response to it. But then, as a therapist, I can't do that, because you also have to take into consideration whether the wife would be ready for something like that. And whether she is ready for that would depend a lot on what is the degree of both emotional as well as individual level, as well as social resources that are available to her in the event that a separation were to happen. For example, does she have sufficient education? Would she be capable of finding some employment on her own, to be able to manage on her own? Would her family back her up in her decision and support her through this process? Now, if you find that in a particular situation none of these things are available, then the one thing that can be done, is to see, it is a sad situation in some ways, because you are getting one person to actually adjust and maintain a kind of a status quo in a very unhappy kind of a situation. But at least the one thing that the therapist can do is to provide emotional support, and in some ways help the person to become emotionally self sufficient, so that at least they are not emotionally so dependent on, and therefore capable of being, um, in some ways hurt, or what they need to do is really make themselves sufficiently resilient, so that the husband's or the partner's actions don't really create too much of a emotional impact on them. That is the kind of help that maybe the therapist can give.
Thank you so much, ma'am. Thank you so much, ma'am. It has been a really eye-opener, wonderful lecture, because it is such a complex topic, and we are always scratching our heads what to do in a critical situation. Then, so ma'am, thank you so much. I'll hand over to the chairpersons. Ma'am, many people have asked for your email ID, and apologies to the questions who have been left because of the lack of time. So if you are able to share, if you allow us to share the email ID, we
Yeah,
can
sure.
share the persons.
Sure. You have it, or
I'll share it, Ali.
We have it. Yeah.
yeah.
Chairperson, sir.
Hello. Yeah, I think thank you, Amrit and Alim. I think probably people also may be ready to say some concluding words. Before that, I just want to say, see, the diagnosis of and management of major depression or schizophrenia doesn't differ from India to USA or any other country. I think the diagnosis and treatment is almost same. But this is a topic where I think most of us, if we are asked to deliver a talk on this, I think we may not ready to accept, because it is a challenging task. Because there is nothing like a fixed, there is no drug, there is no fixed formula. Whatever this thing, it all depends on the social, cultural aspect, the therapist factor, the therapist personality, and the therapist belief systems, and also the couple's personality and the background, and so many other factors. So the outcome also is not guaranteed. Whereas in major depression, we know most of the cases we are sure that they will improve. But here it is these are the cases, challenging cases, both to treat, manage, and Ahalya tried her best how to heal the ruptured. Healing the major depression or schizophrenia is much comparatively easy than healing the ruptured relationships, especially the marital relationships. I think hats up to Ahalya Raguram for the excellent way she has dealt in a very simple and informative way, and she has given very practical tips. Many people are asking me in the morning, are you going to give us the tips? How to handle means what? how to maintain relationship or how to cut off a relationship, like that in a lighter way many people are asking, and Ahalya has clarified most of the doubts raised by the people. So thank you, Ahalya, for the wonderful talk. And I think now over to Vipul for his concluding remarks, and then back to the moderators and also Tofans for their final remarks and winding up.
Thank you, sir. Ma'am, I just want to thank you for a very excellent oration and very lucidly you have explained the very practical aspects and the way that you have answered the question. It's wonderful and it's an eye opener for most of us. And I would like to thank Tufan Badi sir, Aleem and Amrit for giving me opportunity to share a very important session of this Thursday music. Thank you, ma'am. Thank you, Tufan Badi sir. Thank you, Reddy sir.
Thank you.
Thank you, sir. So over to Dr. Tufan sir. Tufan sir.
Thank you, everybody. First of all, I sincerely thank Dr. Ahalya Raguram for giving a lucid presentation of a very complex topic. But the last issue raised by Amrit, when there is a compulsion for the victim to accept a compromise, accept a repair, is it really a repair? Or you are allowing the wolf to continue as a wolf and numbing the sheep? Morally, ideally, this is an ideal situation, but we are helpless that we have to accept this. And another question is trying to raise is there any gender difference between the success of repairing the ruptured relationship when the offender is a male or offender is a female? Just these two issues.
You asking, is that direct?
Yeah, yes, you can ask, you can answer best.
I don't know, it would be difficult to say. I don't think really gender of the offender really has anything to do with it. It has more to do with the couple and how committed are they, how willing are they to put in the necessary effort to bring about a resolution to the problem. And basically, I don't think there are any studies as such that have looked at these aspects.
Okay, thank you, Madam, again. And over to Amrit for the conclusion.
Okay, thank you, Tufan sir. Sir, before I end, I would like to request you to put Ahalya Madam's email ID on the chat box, Tufan sir. So first of all, let me give my heartfelt thank you to Dr. Ahalya Madam. Today was Dhanteras. I told Madam it's a holiday. People might not be there, but then she agreed, and we had maybe more than around 380 or 390 people who had logged in today. That's a huge number. More than 600 people who had registered. She talked about ruptured relationship, and the way she handled it, the way it changed the perspective when we see a patient now, how to deal with it. We always identifying with many times with the person who has been hit more, but sometimes we have to take a neutral view, and maybe our perspective towards such couples will change. Thank you, Ahalya Madam. You have been wonderful. You have been very patient. We were more impatient. We wanted to end the session. You wanted it to go on and on. We'll call you another time, Madam. There's a lot of requests from a lot of people to have you again. We'll choose another brilliant topic. Dr. Indla, a great man. I'm a big fan of him because the sex, love, relationship. He's the guru. And, wherever I'll be there, I'll go and hear so I will be speaking something great. Thank you so much, sir.
He has given that talk in IPS Odisha State Branch Conference.
It's a pleasure having you. It was great knowing that you both were batchmates, and thanks.
I am typing
Dr. Vipul,
the email ID.
We got a lot of trips, conferences, meetings, but meeting him in an academic. Yeah, please. Thank you so much, Dr. Vipul sir, for sparing your time. Dr. Tufan sir, wonderful as always. He always takes the back.
Madam, I have posted your email ID. Just please see if it is correct.
There's no
Dr. Tufan, always he will be in the back, supporting you, helping you, guiding you.
There's a small, sorry to interrupt. One correction in the spelling. It is Ragu.
Oh, okay, okay.
Thank you.
So all please note that it is Ragu.
Yes.
Those who are
Thank-
noting
Sir,
it
sir,
down,
sir.
just make it RSGU because I don't want to delay. Thank you, madam, very much.
Yeah. Thank
Sir,
And I
you.
am very,
I'm
sorry
giving the
we
thank
delayed
yous.
you, though you wanted to prepone, but nothing is in our hands. Thanks. With
Yeah,
folded
I'll come
hands.
to that. I'll come to that also. Sir, on behalf of the IPS Odisha State Branch, I would like to thank all of you. You know, IPS Odisha State Branch, Tufan sir, my Thursday musings team, me and Alim, Tarda, Sazia and Rucha, they're the backbone. All the people who follow us like a religion almost. Madam, why we could not prepone the session to 7:30 was because people would automatically log in. We have a set of dedicated people, 400 people who would log in at 8, 5, 8, 10 after Alim and me stop speaking. So if we would have started at 7:30, they would have missed most of your talks. So it was, no, we couldn't help it, madam. We had to do it. Even though you must have been cross with me, but I didn't, accept your request. But my apologies, madam. But we had to. We could not change it because we changed it once, and a lot of people were
I
disappointed with it.
explained, madam, and she was kind enough to accept. I explained and apologized. We cannot
So
keep.
I was afraid to come in front of her. I know. So because of that, thank you, Torrent. Thank you, everybody. It was wonderful. Happy Dhanteras. Hope you had took enough gold from madam's bank of knowledge to get it into your head. So happy Diwali, safe Diwali. Meet you next Thursday, Thursday musings, same time, same place, with me and Alim trying to bore you. Good night. Good night, everybody.
Thank you.
Thank you so much.
Amit,
Thank you
Well,
all and
thank
you,
you,
wish you a
everybody.
happy Diwali.
Bipul,
Thank you,
nice to
madam,
see
again.
you after a long time,
Thank you, sir.
just in spite of Corona.
Thank you, sir, for giving me an opportunity. Thank you, sir.
Thank you, everyone.
Bye-bye. Good
But
night.
I
We close
enjoyed
shop.
your ORCHA conference, all the meetings, everything very well.
Thank you, sir.
Anytime luck permits, I shall go there again with family.
Ji, sir.